Do you know that dry mouth in our senior citizens can be a sign of a very serious health conditions? Most of the time, we do not attribute that to serious health condition until it's very late. So on today's video, I'm going to take you through a journey of some of the things that if you have a senior citizen with you, it could be a parent, your grandparent, experiencing dry mouth and what you should look out for. So let's dive into it. The first thing that you should pay attention to is medications that they take. Because most senior citizens are on more than 10 medications if you look into their medication box. And what we call in medical terminology polypharmacy is the number one thing that you should look out for if a senior citizen is having dry mouth persistently. Look for medications like antihistamines or antipsychotics, antidepressants, or even some of the high blood pressure medicines can cause dry mouth. Or if they are on water pill, diuretics, they can cause dry mouth. Most of the medication that cause dry mouth has a property we call anticholinergic properties. And so they will cause dry mouth, and therefore our citizens becomes confused because of the persistent dry mouth. They don't want to eat because they're experiencing pain in their mouth because of the dryness. That's number one. The second thing you want to look for is chronic inadequate fluid intake. The senior citizens have been known not to be drinking very well. In fact, I work in the ER, Center on a ward, and we actually even hospitalize people for dehydration because they are not drinking a lot. And this because they don't pay attention to how much they drink. So the best thing you can do is to have some kind of an alarm to just every maybe 2 hours ringing the alarm to let them drink adequate fluid. Now, this is if the patient do not have heart failure or kidney diseases, then they can drink enough amount of water because this can prevent them from having what we call kidney failure, because inadequate drinking of water in the elderly can lead to acute kidney injury, which leads to hospitalization. In fact, people with dementia, if they don't drink enough water, their cognitive function actually get worse because they're not drinking very well. The third thing is not to miss if there is a new onset of type 2 diabetes, because sometimes the only symptoms that is manifested in the elderly is the fact that you're not drinking enough water and they have dry mouth. And so this can be a sign of type 2 diabetes, and so you should not miss that, especially if it's associated with polyuria. That's when they are peeing a lot, even though they're not drinking, and they have weight loss, or just that the feeling that they want to drink things like soda all the time. That can be a sign of type 2 diabetes, and we don't want to miss that. The fourth thing that you don't want to miss is an endocrine disease, or as we call the Sjogren's syndrome. The Sjogren's syndrome can also present as dry mouth, or they can people can have fatigue, or they can have joint pain. So if the elderly is having a lot of fatigue, they're having a lot of joint pain and associated with dry mouth, then you need to see an either a rheumatologist or endocrinologist so they can make that diagnosis of what we call Sjogren's disease. So that's what you don't want to miss. Now, the next one is if they are diabetic and they have a lot of dry mouth, they could have what we call hyperosmolar coma, or hyperosmolar state, because their sugar is very, very high, and so they're experiencing the dry mouth. And so do not ignore this dry mouth syndrome in the elderly, because timely taking them to the ER will save their life, especially if they're diabetic and they're experiencing that, they're having the hyperosmolar state that can kill them. So you want to make sure that you take them to the hospital immediately, to the ER. The next one I don't want to miss is people who have chronic saliva gland disease in their mouth can experience dry mouth. And in these elderly, when they're having dry mouth because of a chronic saliva gland diseases, they refuse to eat. They don't want to drink. They don't want to eat anything because they have pain and swelling in the mouth. So it would be a good idea to have them see a dentist or an ENT specialist to look into their mouth very closely and to be able to make a diagnosis so they can help them. Now, what you don't want to miss is a malignancy of the neck or the head area, because malignancy of the head and neck area can also manifest as just dry mouth. Now, if it is associated with weight loss, all right, severe fatigue, weight loss, you want to pay attention to that because it could be malignancy. And so timely diagnosis will be able to save our elderly. This could be your grandma or this could be your mother. So again, the key point is that dry mouth can be a sign of a serious health issue in the elderly. So you want to pay attention to that. Now, if you like this video, this has been a good information for you, subscribe to my channel, hit the button, give me thumbs, and come back here for weekly tips that can help you save your life and the life of your loved ones. Until then, Dr. Moses, I'll see you on the next video.